the legacy data paradox. Information is key. We want information. We want information to make the most informed decision that we can, but we keep on siloing all this information. We put it in different pockets. We put it in different systems, and we make those decision makers, the practitioners, your HIM, your clinical informaticists, we make them hunt for the information. So let's think about this a little bit differently, and let's bring the information to them and make it as easy as possible to access the information that they need in a day-to-day, minute-by-minute business setting to make the most informed decision. The headache in health systems is they're under pressure. You've got requirements on the meeting times. You have 17 minutes per encounter. So everyone's tracking how effective we are and how we can move patients through an encounter. But then we have to ask those practitioners to go look for information to make a decision to get through the encounter. So we're putting this information all over the place, and we're asking folks to go faster and find it quicker. Why are we making it more difficult? I was just having a conversation with a surgeon last week. He spent 2.5 hours looking for one piece of information for an upcoming patient visit. It took him 2.5 hours to go back into the archive to find critical information so that he could prepare the best care plan for that incoming encounter. Pajama time, clinical burnout, HIM managers, we go to conferences that are bringing in therapists to talk to our practitioners. Let's actually think about what they need, and let's actually build systems that make their lives a little bit easier. If we connect the patient record, if we think about the archive, which is clinical history, and bringing it to that decision point at the bedside in the care planning, then we can allow that practitioner, that expert, to move on and get through that decision-making process a little bit quicker. Let's think about making a decision on limited information versus all information. So if you're going to make a care determination, or you're going to make a billing determination, or maybe you're going to resubmit a claim, but you only have a limited data set versus all the information possible, how do you think the probability of that success is going to be? So what we're looking at and what we're focusing on is bringing all the information possible to that point of decision, to that point of care, so that you see the full scope, not just part of it. So if you're coming in with a shoulder problem and you've had this shoulder problem for 5 years, but you're only looking at 1 year of history, what are we doing? How are we looking at the best care plan? Care is one thing, but you think about adjudications for billing or resubmission on claim status. Look at the total picture. That's what the archive has. You're making a determination on just what's online. There's a bigger world that you can make a better decision for. Context switching. We know that that's not effective. We've had so many experts through the past 50 years talk to us as business leaders that context switching is not an effective way of running a business. Swivel chair is the more commonly used term, where you're looking at different systems for different information, all to do one thing, and that's to make a determination and make a decision. So bringing these together and eliminating the fact that you've got to go hunt for information, that you've got to keep on looking around, let's all bring it to a consolidated point. That's the concept of interoperability. That's truly interoperating in that moment so that you can make an informed decision and you can move forward and you can keep on processing. Right now, we're forcing our leaders to keep on looking for this information just so they can get to the job that they're hired to do, make the decision, a care plan, a bill, submission, a claim, whatever it might be, an intake. We're looking all over the place just to do one thing. We don't have to. All the technology exists that we can bring this together. So the focus that we have from an archive standpoint is to connect this information so that you don't have to keep on looking for it. We don't want you context switching in the moment. We want you to be single focused, move through that process, and then get on with the next one. AI is here. Everyone's talking about it. What do we do with it? How do we actually employ that? Think about the archive as a learning data set. It is what you did yesterday. The tagline is, yesterday has so much to teach us. AI wants to learn. It wants to learn continually. Your archive and your archive provider has all of your information that you just got done working on. Give it to your AI processes, your initiatives. Let it learn in your world in a safe way. So think about that. And when you're looking at how does AI going to improve our business operations, you have a huge training set if you talk to your archivist. I think what I'm challenging healthcare leaders is to rethink what they do with an archive standpoint. It used to be compliance and regulatory. It's very, very powerful. So I'm asking them to ask me the questions, how can you make me better?